Life Unrehearsed, brought to you by Lianas Senior Transition Support, specialists in home care and senior residences.
Good afternoon. Welcome to Life Unrehearsed. I'm Matt Delvecchio, specializing in home care, downsizing, and the senior living industry. Thank you for tuning in. Coming up on the first half of the show, did you know that it's National Caregivers Day this coming Tuesday, April 2nd? This time of year is an important time here on Life Unrehearsed, as we often tackle subjects related to caregivers and the sandwich generation. I'm going to be speaking to caregiver specialist Claire Webster, who's going to be providing some helpful tips and words of advice to families. And on the second half of the show, elder care planning specialist Kirsten Bennett's going to be joining me to discuss some of the important aspects of the aging process and what we could be doing now for ourselves and our loved ones. And I'm also going to be talking about the trend of leaving legacy gifts to a cause dear to your heart. Well, we're going to hear from the inspiring story from the Dean of McGill's Faculty of Dental Medicine and Oral Health Sciences to tell us more about it. Can't wait for that. I hope you're enjoying this beautiful sunny Sunday afternoon, and wish everyone a happy Easter to all those celebrating Easter. And, I had a good start to my day today as I took my daughter and her boyfriend out to a chalet barbecue for lunch there on Sherbrooke. And boy, oh boy, what an institution. 1944 when it started, my grandparents went, not just my parents, grandparents went. And it was nice to pass on to the tradition to a fourth generation. And I hope you have the chance to be with some family, enjoy some good times today as well. As mentioned at the top, this coming Tuesday, April 2nd, is National Caregiver Day. Did you know that almost 1 in 4 Canadians are caregivers? And in fact, employee caregivers make up 35% of the total Canadian workforce. That's representing 1 in every 3 employees. And almost all caregivers are unpaid, and they were most likely thrust into the role of caregiver with no formal training. It can be stressful, exhausting, and certainly overwhelming. And I'm joined today with caregiving specialist Claire Webster. Claire is the founder and ambassador, McGill Dementia Education Program, and the founder and president of Caregiver Crosswalk. Claire, welcome back to Life Unrehearsed.
Thank you, and happy Easter, Matt.
Thank you, Claire. You too, to you and your family, and thank you for joining me as we approach National Caregiver Day. You were the first person I thought of, Claire, as to who we could have on as a guest on this special show today on Life Unrehearsed. So for our listeners that may not know your story, Claire, can you tell us your story?
So basically, I grew up in a home as an only child, watching my mother be a caregiver to my father my entire life. So I feel like caregiving has been in my DNA. And later on, when I was pregnant with my third child, I was on bed rest. Shortly after the birth of my child, my father passed away of congestive heart failure in 2005. And a year later, my mother was diagnosed with Alzheimer's disease. And I was a sandwich generation caregiver with 3 young children, and I knew absolutely positively nothing about this illness. And the only prescription that I received from the doctor, the neurologist at the time, was "Good luck, Mrs. Webster." And as a result of not being properly educated, it really had a significant impact on the quality of care that my mother would not receive. And it also had a ripple effect on my own health and well-being, as well as that of my family. So I went on a mission years later to become a real caregiver crusader in the field of dementia care education. And I've been doing the work I am now for close to 18 years.
And wonderful work indeed, Claire. You've come a long ways from "Good luck, Mrs. Webster" to where you are now, helping thousands and thousands, not just in Montreal, but around the world, as we're going to hear a little later on. And it's a wonderful story, Claire, in the sense that you've been able to turn around, learn on your own, and be able to give back to a lot of people, because it was a very rough ride for your mom, your family, for you personally, and it is really inspirational what you have done. So, what I'd like to talk about, as our population ages, and it is certainly aging quickly, we're starting to see the cracks in our healthcare system. Some would say it's much more than cracks, Matt, and it's not getting any better. How important, Claire, is it to advocate for your loved ones?
So, I specialize in dementia, which is a very complex illness because it's one that is ever evolving, and it requires, many different types of healthcare professionals. But I would say that in general, with regards to any disease that you're dealing with, you really need to be one step ahead. And, I feel like when we go see the doctor, we're afraid to ask questions. We're afraid to, if we're not sure about what they're telling us. So, when I always say with dementia, as the disease progresses and my mother was no longer able to communicate, I became her voice. So it was up to me to ensure her dignity. It was up to me to ensure that she received the best care possible. And as a result of our current healthcare system, I hear a lot of caregivers who are literally waiting by the phone to get that call from the social worker, from the CLSC. And you can't be the one to sit and wait by the phone. You need to be proactive. You need to follow up with social workers, follow up with doctors, follow up with nurses. Don't just, sit by the phone. Like, make sure you're out there and really progressively following up.
Talking to Claire Webster, caregiving specialist here on Life Unrehearsed with Matt Delvecchio. Claire, I really like what you're saying here, because you and I see this all the time, and the delays in getting answers are getting more and more challenging. So you just can't sit by the phone and wait for answers. Other families are being proactive and calling, and you are going to have to do the same as caregivers. And it's not easy. Some people, are respectful of the system. Everyone knows the system's stressed, but really advocating, Claire, you are one of the biggest proponents of advocating, and we need to do that. And so you and I both have seen overwhelmed caregivers time and time again, Claire. And so how can we prevent our role from becoming overwhelmed in caring for a loved one?
Well, the caregivers that I work with, most of the time when people are overwhelmed, it's because they just don't understand the situation, okay? They don't understand the behaviors. They don't understand the disease. Why is it progressing? Is this normal? So I would say, to begin with, really about becoming as educated as possible. Like, understand the disease that you're dealing with, okay? That's number one. Number two is that don't say, I'm not there yet, okay? So when you're like, if in order to get access from the resources, understand the different resources that are out there that could support you, whether that be not-for-profit resources or for-profit resources. But I find a lot of people are saying, I'm not there yet, I don't want to call, we're not there. But what ends up happening is a crisis will occur, and then because you haven't done your homework, you're not educated, you don't know what resources to do, then people go into panic mode. So just be one step ahead all the time. If you're dealing with dementia and the person's in the early stages, understand what's coming next in the later and the middle and late stages. Understand all the resources that could help you, even if you're not there yet.
Yeah, I'm glad you mentioned it. And like you said at the outset, it's not just about, for example, caregiving for dementia. There's so many caregivers for so many different causes. And, we know public system is there first. CLSC is the first place to go and talk to social workers. It's tough out there. So other resources beyond public system, real quick before we get out to traffic, Claire, what would you suggest? Who can caregivers turn to above and beyond the public system?
Above and beyond the public system, well, there is the LAPPUI, which is L''APPUI, which is really like a resource, one big resource hub for all the different diseases that people could go on. You have, with regards to dementia, you have the Alzheimer's Societies of Montreal, AGI, you have NOVA, which is a great organization. And then, of course, Matt, we're going to be talking about the McGill University Dementia Education Program.
I'm glad you mentioned that, and that's a big part of your life, McGill Dementia Education Program. In fact, we're going to talk about that when we come back.
Life Unrehearsed, brought to you by Lianas Senior Transition Support, specialists in home care and senior residences.
And welcome back to Life Unrehearsed. Matt Delvecchio here, and I'm talking with caregiving specialist Claire Webster as we approach National Caregiver Day this coming Tuesday, April 2nd. Claire, continuing our conversation about caregivers, and I know you are a big proponent about self-care, and you speak from the heart when you talk about self-care. Why is it so important to recommend to caregivers that you need to take care of yourself first?
Well, if you don't take care of yourself, how are you going to be caring for the person that you love, right? And, caregivers have the tendency to put themselves last. And I would say probably the two biggest emotions that caregivers go through are guilt and also anger. And, guilt really hurts you more than the person that you're caring for. And, anger is the other emotion that people, I guess, feel a bit of shame talking about, but it is probably the emotion that I hear the most.
Mm-hmm.
But it's extremely important to take the best care possible of yourself. And, I know one of the questions you're going to ask me is what do I recommend to avoid a burnout? And I would say it's about becoming very selective and protective of your time. Put your energy into the people and projects that really matter to you and let go of what doesn't. For example, my mom passed away in 2016, but I've become very in tune with myself because I'm someone who suffered a very severe burnout. And, even this past week, I was invited to a whole bunch of things, but I was just feeling very mentally tired. And I just said, no, I have to put myself first. And the other thing I think that's really important is to be mindful of the coping mechanisms, meaning, when we're feeling stressed or overwhelmed, some people could tend to drink more or smoke or take Ativan or eat more or shop more. So be careful that certain coping mechanisms don't turn into addiction.
Great words of advice, Claire, because as you know, these things can get out of hand very, very quickly. And at the same time, you are also still playing the role of caregiver, trying to care for a loved one, which compounds the challenges. Now, Claire, before we went out to traffic, we were talking about resources. And as you know, on Life Unrehearsed, we try to get as many resources out there for whatever subject we're tackling. And this week is all about caregivers as we approach National Caregivers Day this Tuesday, April 2nd. When you were talking about resources, I'm really glad you mentioned L'Appui. They're actually going to be guests on our show next week. Wonderful caregiver organization with a ton of resources. And I'm glad you did a shout out for Nova, Montreal, and I'm on the board of Nova West Island. They're just such wonderful nonprofit organizations that are helping families. Now, another great resource, Claire, and we have to talk about the McGill Dementia Education Program. You are the founder and ambassador of the McGill Dementia Education Program. It's one of the country's leading resources for caregivers. So can you tell us a little bit more about these resources?
Yeah, I founded the program in 2017 with McGill University, and I had no prior affiliation at all with the university. And I knew that we were fortunate. I was fortunate to live in a city where we had probably one of the best medical schools, if not in the country, in the world. So I lead the program with Dr. José Moret, who's the director of geriatric medicine, Dr. Serge Gauthier, who's a world-renowned neurologist, and Dr. Pedro Rosanetta, who's the director of the McGill University Research Center for Studies in Aging. And we offer a wide range of free resources to support persons living with dementia, caregivers, healthcare professionals, and medical students. So one of our most important resources is our Dementia, Your Companion Guide, which can be downloaded for free. It's now available in 12 different languages because dementia doesn't discriminate. And so it doesn't matter, what culture you are, what religion you are. And for us, it's extremely, extremely important to support as many people as possible. So printed copies are available on Amazon, and there are multiple copies that are distributed throughout the MUHC hospital system. So that's one of our resources. A couple of weeks ago, we just launched these activity videos. There are 12 video capsules to teach caregivers how to do leisure and recreation activities with their loved one. They're available in English and French. We also have virtual support groups. We have a full program called The Sharing Room in collaboration with the Alzheimer's Society of Montreal. We also have a young caregiver support group. We have a wonderful program in collaboration with McGill School of Social Work called Caring Conversations that's hosted by Lucy Baralek and Joanne Besner. And, another big part of the program is myself and especially Dr. Gauthier. We go out into the community and we give a lot of free public education lectures. So the best way to to understand what's going on is you go to mcgill.ca/dementia, but please subscribe to our newsletter because then you'll always be in tune of what's coming up in terms of our program.
As I'm listening to you, Claire, and I've had you on the show over the years, and it's just amazing how many resources. And every time we talk, there's more additional resources, including these amazing videos that you're talking about. And we featured them a couple of months ago, and they are fantastic. So again, we're going to ask at the end of the interview how people can get a hold of these things. But one more time for this specific regarding McGill Dementia Education Program, where do we go? McGill?
You go to mcgill.ca/dementia.
Okay, very, very good. All right. Another initiative, Claire, that you are leading is a wonderful webinar called McGill Cares. It's a webcast series designed to support family care partners. And can you tell us a little bit more about McGill Cares?
Well, when COVID happened in 2020, just prior to the COVID, we were doing a lot of in-class workshops for caregivers. And as soon as COVID happened, I said, oh my goodness, how am I going to stay in touch with caregivers and continue to educate them? So I've produced over 100 webcasts featuring a wide variety of leading healthcare professionals, not from within Quebec, but from Canada and the world. And Matt, you have been my guest on McGill Cares quite a few times. But there are so many webcasts. People just go to our website, you go to the archive section, and I think we've covered almost every single topic under the sun. And we even have had topics relating to cancer, to Parkinson's disease, to ALS. So many topics, and it's just people just could access it for free, and they're all there.
And that's under
a whole library of them.
McGill Cares. One that's upcoming, I think, is notary and a social worker talking about the whole wills and power of attorneys and protection mandates, and that's going to be one to look forward to. Claire, I'm already running out of time. We have about a minute left, but there's two very important initiatives, and you're going to be participating in, so we're going to cover them both. I want to make sure we talk about it's National Caregivers Day this Tuesday, and you are going to be a panelist on Carers. It's called Carers Canada. Tell me about that.
Yes, so I'm going to be a panelist, and I'm going to be talking about the wisdom of caregivers and how we can bring our wisdom and work with academia. So essentially, I'm going to be talking about the skills that caregivers have that could help educate healthcare professionals and medical students. So that's one very important panel that I'm going to be on this Tuesday.
Congratulations for that. And you are going to be a keynote speaker at the upcoming Alzheimer's Disease International's 36th Global Conference in Poland. And that's going to be taking place at the end of April 24th to 26th. What were you going to be discussing as a keynote speaker there?
I am going to be talking about improving post-diagnostic support and quality of life through innovative education and training. I'm going to be talking about the McGill University Dementia Education Program to the world. I am so incredibly grateful and excited for this opportunity.
And I know you are grateful, but it's so well-deserved. I'm so happy for you, Claire, as you cross the pond to spread the word. And this is just not a European. This is world Alzheimer's disease. So very good for you, and congratulations. Claire, we're out of time here. How can our listeners reach you?
So the listeners can reach me by going to mcgill.ca/dementia, or on my website as well, www.carecrosswalk.com.
All right, so that's carecrosswalk.com or mcgill.ca/dementia with a ton of free resources there for families. Claire, thank you very much.
Thanks, Matt.
All right, thank you. That's caregiving specialist Claire Webster. Claire is the founder and ambassador, McGill Dementia Education Program, and the founder and president of Caregiver Crosswalk.